Hi, Mark Linneberry here with Local Mia, the best of local. And the best of local has usually been more about, our local businesses and really highlighting them. But, a lot of times it's about the best of local people making a difference in our communities. And we've got one story here to share with you today, and that's with Monica and Alfred Cavazos. And both of them are here today with me to talk about a project that I know Monica's been heavily involved with. I know Monica more as a local realtor in the community, but now we've come to know that she's actually a nurse as well. So welcome, Monica. Welcome, Alfred. How are you?
Hi, nice to see you, Mark.
Good.
With social distancing from the internet.
That's right. That is right. We were all getting a little more used to this right now. So I think, using it on networking and different things like that, but I really want to use it to tell these stories. So the story I came across as I was scrolling through Facebook, and I think you even sent me an invite to this group called Mask Makers Fighting COVID-19. And then, got to thinking about COVID-19. Was that even a term that you were familiar with, say 3-4 weeks ago?
We heard about it, but I didn't think it was as serious as it is. I blew it off at the beginning, but with the government opening up the state lines, it made something trigger, and I said, okay, this is pretty serious. We need help.
So you heard that you needed help, and in your line of work, what was the help that was starting to be asked for?
The nurses, we're already short as it is. So there was a lot of facilities contacting me. They needed nurses. They needed retired nurses back into this. And especially because we were short on PPE, protective wear. As soon as they opened up the door for graduates and non-licensed healthcare employees, I knew there was a need.
And so then you got back in, you're nursing and with your colleagues, and then you got to tell me how did this Mask Makers Fighting COVID-19 come about?
So realizing that we were short on PPE, I remembered about Harvey. I knew that as community members, we needed to help each other while we waited for bigger companies and the government to step in. I decided to get this started. So within just a few of us, I reached out, stayed up late several nights trying to see who knew how to sew, because I don't even know how to thread a needle, So once the CDC announced that we could use bandanas, I knew that there was something that I needed to do. So we started this with a very small amount of people, and now we have over 1,000 members on the group.
So there's 1,000 people helping sew masks now?
Well, they're helping sew, and there are nurses that are requesting, and there's others helping to do porch drop-offs, pickups. I mean, people are, it's amazing how people are coming out to even cut patterns, which greatly help. They're trying to help in any way they can.
So that's really interesting. Are you finding any shortages of things that you need to complete this process?
Yes, we've had thousands of requests.
What's the total count for the masks?
It's for sure over 1,000 requests. 10,000 requests.
10,000. Okay.
Yes, and I mean we're trying to do as much as possible, but we need mass production, and we need the community involved. Anybody can sew from home. A lot of people are, it's been over a week and that we started this group. And we find that people are starting to, say, hey, my grandma's getting tired of being inside the house so long. She wants to help with this. Mm-hmm. And so every day there's more people volunteering, but we still need a lot of help. Because of course we don't have the machines that cut patterns, and
okay.
we need mass production from the community.
So it's an actual, we're all starting to learn the term supply chain a lot lately, and so there's a whole process. It's not just because you have some material that you can just make one of these. There's a pattern that needs to be cut. There's a process, and there's some guidelines that you're actually following from the CDC to make these masks.
What we have so far is the CDC recommends a cloth mask and as a last resort. And I've had some controversy on these masks. I can tell you though that those at the front line are feeling lots of support and love from the community, and those at home not having much to do right now feel like they're actually doing something to help the situation. I personally, as a nurse, if I'm seeing a patient, I know these masks are not going to protect me from the virus, but I'd rather have someone sneeze or cough onto the cloth than my own, face without anything.
Right. Right. So I understand. And some of these, they have some pretty nice patterns to them too. They're a little festive, or can be, right?
Yeah. So the ladies are getting creative and, coming up with different patterns for the requests. We had a facility that had a sign that said "Heroes work here." So the sewing pro made masks of superheroes and delivered those. So they're very personal, very and it's just touching the healthcare community.
So there is a difference, between the kind of mask you're producing and the big national push right now on things that there's shortage of, like I believe the term's N95 type masks. But people need to understand there is a difference. But your healthcare workers, there's a need. You have people requesting your type of masks that your group is producing.
Correct. The CDC does recommend that we wear a sort of a plastic or a shield over these masks to help. And we just started making those. We've got volunteers working on those as well. But for the meantime, the nurses that know this, they're wearing goggles to protect the eyes.
So Alfred, I got to ask you, what do you think about Monica and what she's doing?
I think it's amazing. She just took off with it, and I mean, she was just at it all night, all day. She'd go to sleep at 2, 3 in the morning and wake up at 6 in the morning. And she's not a morning person, but this kind of flipped her. I mean, she was up before me and she was going to sleep after me. And I'm like, who is this person? But no, she's done a terrific job trying to organize this and put this together. And she's seen the need, and she's got a big heart. And so being that she's in the industry, and she didn't mention, but she was actually an ICU nurse at one of the local hospitals here. And so she was on the front lines, and she knows what, those people go through. And so some of the stories that she was receiving from her colleagues were tremendous. They were having to use the N95 masks over and over and over again. And stories that were coming out of some of the hard hit areas like New York and California, where even the doctors and the nurses and the healthcare staff, they were being infected themselves. And so, you have to ask yourself, if our healthcare community becomes affected and they become sick, then who's going to take care of the rest of us? And so that's kind of where this all came about. And so it's really evolved. She asked me to get involved from my background's engineering. And so I just got in it to see if I could help with whatever, the face shields, these masks. And because obviously, the push is for the N95s, right? Those are going to protect the best.
Right.
But this is a backup, and it's according to the CDC. They say if you don't have a N95, then at least use this, as a last resort. And so what we're finding, and what she's kind of mentioned to, is that a lot of the community, or the healthcare community, they're using them over the N95, and it allows them to prolong the use of the N95. And so there's a need, and you know, there's obviously people that are out there that's saying that they're not really useful or whatever, but they are, and they're helping. And like Monica said, it's if nothing else, it provides a sense of community and support for the healthcare community. I mean, I would hate to have that job right now, and I hate saying that, but can you imagine being in a hospital in that scenario?
We are thankful they are there, and we're thankful to the both of you. And Monica, how can those watching actually help you with mask makers fighting COVID-19?
We need people that are sewing or willing to learn how to sew. We've got some beginners, and they are actually teaching others now.
Mhm.
So if there's anybody that knows that and or has a desire to learn, we really need more manpower in sewing. We've got thousands of requests, and unfortunately we're not able to fill them.
And what's the best way to connect with you? Is it through the Facebook group?
Yes, through the Facebook group, we now have forms to fill out. So we're trying to improve every day. We have forms for people to fill out, either whether you need a mask, you have masks ready to donate, or you can donate funds to buy the fabric for those that sew. There's so many ways to help.
Even from a logistical standpoint, I mean, we've got colleagues from our other business that have stepped up to not just sew but deliver masks, pick up masks, material. I mean, the first several days, Monica was like leaving early in the morning, and she wouldn't get back till past 10 o'clock at night or later. And so the logistics of it is where there's a need as well.
Okay.
Drop off points, delivering masks, picking up material. Like you said, funds are obviously going to help. We've collected just under 3,000, and so most of that, or at least more than half of that, has already gone to just pure fabric, purchasing fabric. And so
my biggest focus is cross-contamination, because if we're picking up these masks and they're contaminated by somebody that doesn't know they have have been tested yet, and they don't know yet, we don't know. So I have a video for those that are volunteers and driving to watch on contact precautions, so we can do the best we can to keep people safe.
Very good. Well, again, thanks to both of you, Monica and Alfred, for joining me today. We're going to help get the word out, and we'll definitely share the information to the Facebook group so they can get involved and help if they have the capabilities. I always like to see it start at the local level, and you definitely are an inspiration to what can be done at the local level. So thank you to you both, and have a great day.
Thanks, Mark. Bye.